Hello, this is Neil Baum from New Orleans, Louisiana. And I'd like to take a few minutes to share with you some suggestions for managing the chronically late patient. This video will cover the current situation regarding chronically late patients, and I'm going to give you some suggestions from my practice and how I have managed the patient who is always late for his or her appointment. Almost every practice has patients who are chronically late, and these patients absolutely wreak havoc with your schedule. As a result, it impacts your productivity when patients are chronically late. And it also causes stress not only on your staff, on yourself, but also on your staff. As a result, chronically late patients who show up after their designated appointment makes it difficult to see patients who did arrive on time and to seeing them in a timely fashion. So, in order to manage the chronically late patient, I recommend creating a written policy of what is going to happen to patients who arrive late. Advise the patients that it is most helpful to you in your practice if they arrive early, 15 to 20 minutes before their designated appointment, to complete their paperwork, pay their deductible and copay, make sure they have had prior authorization, and they have completed all of the forms that are necessary for the practice. You need to explain in your policy the impact that not arriving on time has on not only the doctor, but also on the staff as well. There are two options, and that is you can consider scheduling that chronically late patient at the end of the day, or when the patient does arrive significantly late, you can consider rescheduling that patient and not seeing them. You do this once or twice, I can assure you they will be on time in the near future. I think it is important to listen to an explanation why the patient is late. For example, if the patient is dependent on a family member or someone else to take them to the doctor for their appointment, then I think you need to make a conversation with that family member or with the person who is responsible for bringing the patient to the practice and explaining how important it is for them to bring the patient on time. Also, if patients have a track record of usually being on time, then I think that patient should receive a little slack if on occasion they are delayed. In order to manage the chronically ill patient, the doctor must set an example. For a apocryphal story that emphasizes the importance of the doctor setting the example is a patient was to be seen by a physician, and on several occasions, the doctor was 45 to 60 minutes late. The patient sent the doctor a bill for his time that was wasted by not being seen on time. Needless to say, the doctor ignored the request for payment for his time that was lost while waiting to see the physician. The doctor ignored that letter and did not make payment. So the patient took the doctor to small claims court. It cost about $600 for a filing fee, and he submitted this to small claims court, but he didn't stop there. He was invited to tell his story on the Johnny Carson Tonight Show, and he named the doctor in front of several million people who were watching the Tonight Show. Not only did the patient pay the doctor shortly thereafter, but he lost the small claims court. So he had to pay the filing fee. He had to pay interest on the fee that he gave, plus on the filing fee, and he had to pay the patient's legal fees. It ended up costing the physician over $3,000, and also a black mark on his reputation because of this exposure to the public. So the doctor must set an example. You have to make a commitment to being an on-time physician. Only when you are on time can you request that a patient arrive on time. Let the patients know that you are making a huge effort to be on time for them, and you would appreciate reciprocity and that they be on time for you. Ask the patients to arrive before their designated appointment time to complete any necessary paperwork. If the doctor is running late, I think it is helpful for someone in the office, the receptionist or a medical assistant, to go into the reception area and announce the delay to the patients, tell the patients an estimate of how long the doctor will be, and give them the option of waiting or rescheduling. An option that I don't recommend is overbooking. This has been tried for decades and has been not very successful in managing your schedule. And on occasion, if there are numerous no-shows and everyone shows up on time, the result will be that the patients who did have designated appointments will be seen with a significant delay. Charging the patient has also been tried for years, and it is well nigh impossible to collect those late charges fees. If you decide to do that, you must warn the patients in writing of charges for tardiness. Better yet is to reschedule the patient, not see the patient if they're chronically late, or move that patient to the end of the day. I also recommend having a facts of life discussion with a patient. Suppose a patient is 45 minutes late chronically for his or her appointment. The receptionist might point out, also this conversation should be held in private so no other patients can hear this discussion. The receptionist might say, you're 45 minutes late for your appointment. And the patient says, well, I was caught in traffic. The receptionist might respond, suppose you had a flight from New York to Atlanta at 2:15 with the departure time. What time would you arrive? And the patient would tell you that they would definitely be there 30 to 45 minutes prior to departure. And the receptionist should admonish the patient and remind them that your practice, if you are an on-time physician, is no different than the airlines. And that if you're going to be on time and see them on time, you expect them to be on time. And if they continue to be chronically late, you tell them that you will not see them and you will reschedule that patient. I sometimes in my 40+ year career have had to discharge a patient, probably less than 5 times in a 40-year career as a physician, because I find that usually by adhering to the suggestions I previously described, we can get patients to be mostly on time. If patients are chronically late, that signifies a lack of respect for the physician and the practice's time. And ultimately, it results in a loss of productivity. If the problem persists and is a chronic problem that impacts your schedule, then I recommend sending probably a certified letter to the patient to find another doctor. By the way, if you go onto the internet and type in discharge patient termination letter, you can find several dozen examples of effective termination letters. I think you have to, by law, give them several weeks to find another doctor, and you also have to offer to provide them with a copy of their medical records. I also recommend, if you're a specialist and are seeing the patient who was referred by another physician or primary care physician, that you contact that physician and explain the situation of their chronic tardiness and that you've had to discharge them from your practice. So what's the bottom line? In 2022, we cannot tolerate patients who are chronically late because it affects productivity, it affects the staff, and affects the patients who are on time. Therefore, I recommend you develop and implement a policy regarding tardiness to your practice. Well, I hope this brief video on managing the chronically late patient has been helpful. If you have any comments or suggestions, or you would like a copy of this slide deck, please don't hesitate to contact me at the email address shown on this last slide. Thank you.